Acetaminophen has been on our home shelves for years, a go-to when it comes to treating pain and fevers and anything in between. But recently, headlines are causing a lot of panic and a lot of fear. So let's help you separate fact from fiction when it comes to taking acetaminophen. Claim number one, there are people, such as pregnant women, who are taking excessive amounts of Tylenol or even potentially overdosing to prove a point to the administration.
Any mother who is taking this stuff during pregnancy just to get back at Donald Trump is doing something that is pathological.
We're going to rate this claim as false. All we've seen is certain pregnant women advocating for the judicious use of Tylenol in certain situations, such as a maternal fever or chronic pain. We know that untreated fevers during pregnancy can lead to some long-term developmental outcomes for the developing fetus. And so when having a conversation with the healthcare professional, it can be deemed that it's totally safe to take acetaminophen in pregnancy, especially because a lot of other pain medications are just not safe to take.
They worry that pregnant women will now be afraid to take the drug, even when they have a fever, which they say can be more dangerous for the baby.
Claim number two, there is no autism in the Amish community because they don't get vaccines and they don't take acetaminophen.
But you have certain groups, the Amish as an example, they have essentially no autism.
This claim is actually false on three separate fronts. First of all, healthcare professionals, pediatricians I personally know have taken care of autistic children who are Amish. So we know that certain members of the community do have autism. Rates might be different because, like any community, there may be differing rates of access to healthcare or going in and getting screened and diagnosed with conditions such as autism. Now, another reason why this claim is false is because members of the Amish community do take Tylenol. I personally have taken care of an Amish child who was given Tylenol, and the parents continued to give him Tylenol as he was recovering from a specific illness. Another reason why this is false is that many children in the Amish community are vaccinated, and they do go and get regular well-child checks and get those childhood, very important, necessary vaccines.
The president drawing the link between acetaminophen and autism.
The reality is the definition of autism has changed over the past 50, 60 years. Back in the day, in the 50s, for example, a diagnosis of autism was considered only in children who had severe developmental delays. Now, the definition has broadly expanded, and we now know that autism exists on a spectrum. So researchers do believe that the rate of autism has gone up because we've broadened the definition, there's more awareness, and there's better access to diagnosis and screening. And yes, there are research studies that have been done looking for a potential link between vaccines and autism, looking at millions and millions of children, and there is no evidence that vaccines cause autism. Claim number three, you should not give acetaminophen to young children, to babies. I'm also going to call this claim false with an asterisk. We'd like to reduce the amount of medications we're potentially giving to any newborns or babies, but there are situations in which we do recommend that babies, yes, even babies, get acetaminophen. There are situations when babies have fevers, they're in pain, they're cranky, they're irritable from a whole host of things, and giving them acetaminophen might mean the difference between them sleeping and not sleeping, or them drinking breast milk and eating or not having anything at all. And guess what? A calm baby who is sleeping and hydrated is a much safer place to be than a baby who's left untreated and uncomfortable. I empathize with people who are turning on the TV, listening to the radio, or scrolling through their phone, and they're like, oh my gosh, is acetaminophen safe? Is it not? I get it. At the end of the day, take a deep breath, look at the science, and talk to your doctor or healthcare professional. We will guide you through it.